Hi there. This video now is the second part of our look at our request one-off test template. And in this one, I want to focus on future dating bloods. Um, it's likely in your practice, if you wanted bloods in, say, 3 months' time, you're probably having to do scheduled tasks or creating recalls and things. With our system, it is much, much simpler. Um, if I say wanted a BMP doing in a few months' time, I put that date in there. And OK in the template will mean that that blood test gets done in a few months' time. In one sense, it's incredibly simple. There's no scheduled task. There's nothing else that needs doing. When that date is reached, the patients will drop into reports to be sent an invite to book in. The complexity really is more around the dates and how we make sure patients come at roughly the right time. So like I just mentioned, this date is the date at which the patient would drop into reports for having the invite. So you may have noticed when I did that, I put in 2 months. So let's say you wanted it in 3 months' time. We would generally recommend that you aim a bit early. So like I said, say 2 months early, in 2 months' time rather than three, because you need time for the patient to drop into the report, which is run regularly, for the invite to be sent, the patient to respond, be booked in and have the blood test. I think for most practices, most of the time, that may well take 3 to 4 weeks. And you may have come across the same issue yourself, where if you're using scheduled tasks, it drops into an inbox for reception, takes reception a few days to get to it, and so on and so forth. So in one sense, there's no great change. The other bit that's a bit different here, though, is also on the right-hand side, you can see other things that are going on for the patient. So we can already see that these blood tests are showing as due. We can also see that there are future dated requests that aren't yet that aren't yet due. So for on the 4th of September, you've got full blood count and hematinics that are already due. If I spot those, it makes sense then to line the dates up. There is a bit of a risk with this template that things can get a bit messy. So if, for example, someone's ordered them on the 4th, and let's say for some reason I decided to put it on the 18th, the patient could end up attending for some bloods between the 4th and the 18th, and then get invited again soon after. Now, you might occasionally want that, but most of the time, probably not. So we'd recommend lining these dates up. There are also other things that the system will pick up for future dates. So elsewhere in our videos, we've shown you about what happens when you start a medication and you can say, yes, I want to repeat HbA1c, say, in 12 weeks' time. Now, we can't make it show the date here. What we have to do is show that it'll be HbA1c 12 weeks after, in this case, 3rd of July. So this is slightly less precise in terms of how the invites work. It's generally 8 weeks after that date that the invite is sent, and we're aiming roughly for that kind of 12-week period for it to be done in. So again, if I was wanting to sort of line up with that, I'm probably looking at the same sort of date. If I said, no, I want 3 months, and I put it 3 months, so let's imagine I change this and put it, say, 4th of October, the problem is the patient may well attend, I don't know, towards the end of September. When that happens, that's fine, but this blood test wouldn't show as being due. And then a few weeks later, it would be showing as due, and it would invite the patient back in. The system has to work that way because partly it's the limitations with System 1, partly because if, say, you've just had a blood test come back and you want to repeat it straight away, it can't be built in a way that it looks at like the last week or so. It has to kind of go, yeah, the request is on the 4th of October. We've not had a BMP done on that date or since that request was added, and therefore we're going to invite the patient in again. So it is an easy template, and it's better and more efficient than doing lots of tasks and things, but it does take perhaps a little bit of getting your head around how it works in terms of dates. A few other things to be aware of. If I say, for example, wanted fasting lipids, I need to future date both of those for it to work properly. And the easiest way if I'm doing multiples of these is to copy and paste. So on my keyboard, Control and C, Control V, Control V. Similarly with things like clinical comments, if I want it to appear around the right time, or if I want other bloods to be done at the same time, again, I'd put the same date in, I don't know, I'm just putting some nonsense in there. In this scenario, then, I wouldn't be kind of saying that the tests are needed now, because they're not. But the beauty of it is I don't need to do scheduled tasks. I don't need admin staff to potentially send individual invites out. That patient will get sent an invite, probably with a link to booking a blood test around that date. And I can see now the tests that are already requested and then extras that I've also put on. Hope that helps. You don't have to use this part of our system, but we do recommend it. Like I mentioned in previous videos, it will also mean that patients get multiple invites. If they're due their annual review at the same sort of time, it will potentially include these bloods with their annual review. So we have found it an efficient way of working. It just takes a bit of getting used to, like anything else. Thanks.